Yes, there we go. Thank you.
And where are we?
You're as young as ever.
I'm as young as ever. I think the order of the slides got. Well, anyway, today we're going to talk about secrets to long life, long health, and sustained happiness. So once we get all that solved, we don't have any more problems, right? And but our big idea for the day is to make Savannah a Blue Zone city. And why would the Georgia Medical Society be interested in blue zones? And first of all, when we finish medical school, we take a Hippocratic oath, and it says, "I will prevent disease whenever I can, for prevention is preferable to cure." And I think that's certainly Healthy Savannah's idea as well. But the Georgia Medical Society is kind of a cool organization. It started in 1804, and I'm pleased to be its 116th president. That's kind of cool. But preventive medicine has been going on in Savannah for a long time. And I went back into the annals of the Georgia Medical Society, and the first preventive medicine outreach was in 1817. There was a yellow fever outbreak, and the physicians of the Georgia Medical Society had an idea. They said, if we could get rid of the water around Savannah, which was rice culture at the time, it might help the yellow fever epidemic. Is it blinking?
Yes.
And that was a really great idea to get the water away from Savannah. But at the time, the physicians didn't know that. They thought it was the putrid air that came from the water. And in fact, 100 years later, we figured out it was mosquitoes, but that was okay. But at the time, they thought it was the putrid air, and so the physicians went out and started digging themselves to break the dikes and try to get the water away from Savannah. They were promptly arrested, and then they were released. And they fought for another 50 years to try to get the water away from Savannah. All right? And so that was and that is one of the first preventive medicine efforts in America. So your history nugget for the day is that drain the swamp is not a new term, okay? And so today we're going to talk about what is a blue zone. That's the biggest question I get. And I've given this lecture several times, and I've met several people who have heard the lecture, and their first question is, what's a blue zone again? So we're going to go over that today. You're going to know. Hippocrates also was big on diet, and I would say what you're going to learn today is that food and your environment and what you do in that environment is probably the most important things you can do for your health. But Hippocrates advocated the diet, let food be thy medicine and medicine be thy food. So I happened along to the blue zones. Dan Buettner went to Okinawa in the year 2000. And that started a quest. He's a National Geographic writer. And he noticed that there were very long-living people in Okinawa. And then he discovered, with a grant they got, they studied all over the earth, and they found where the longest-lived people were. And there are 5 strange places: Loma Linda, California; Nicoya Peninsula, Costa Rica; Sardinia; Ikara, Greece; and Okinawa. And in those areas, people are 3 times more likely to live to be 100. And on average, people live 12 more years than U.S. citizens. So there's something going on there. So with the study, they tried to figure out that the blue zones all had some similarities, and they had some differences. The Loma Lindans ate nuts and had healthy social circles, and the Sardinians ate fava beans and drank their high polyphenol wine. But when we looked at all the common areas, they tried to drill down and get to the most important concepts, the ones that were common to all these areas. And you can see in the middle there: family, no smoking, plant-based diet, constant moderate physical activity, social engagement, and legumes were common to all those areas. But each one of them was unique at the same time. Okinawa had all the women, the longest living women in the world, whereas in Sardinia they had the highest concentration of male centenarians. And in Loma Linda, strangely enough, Americans that lived 10 years longer than other Americans. So what are the common threads? So Dan Buettner boiled it down to the power 9. And we'll go through those 9 because, like I said, nobody remembers, so we're going to beat it into you today. And I would refer you to Dan Buettner's excellent TED Talk. It's a little dated, it's 2009, but it still is an excellent 18-minute summary of his work on the blue zones. So we'll go through these power 9, and a lot of times when I get finished with the 9, people say, "That's it?" And I say, "Yeah, that's it." And I'd like to tell you that if you're looking for something to have a long life and long health, it's right here. Okay, you might have fooled yourself into thinking it's something else, but there's centuries of wisdom baked into these power 9. And also, I like to say, as a physician, there's evidence-based medicine obvious in here that if you're looking for long health, then you can find it in the power 9. So let's go through them. Number 1, move naturally. People in the blue zones, they don't necessarily go to the gym, they don't do push-ups, they just do their life. They go up and down the mountains of Sardinia chasing their sheep. They fish in Okinawa, and the Loma Lindans are very busy. Here's a man who's 100 years old who is out water skiing. So they continue to move and move naturally. When you look at groups of centenarians, they do something physical every day. So find out what you like and get moving. Second, they have a purpose. In Japanese, that's called the ikigai. In Spanish, in Costa Rica, they call it a plan de vida. But the way we can translate it very simply is you have to have a reason to wake up in the morning. So here's a great-grandfather in Costa Rica who's looking after his great-grandchildren. Principle number 3, you have to be able to downshift. Americans don't stop. We stay on our cell phones till we go to bed at night. We cannot calm down, and you have to downshift somehow. Here's a Sardinian family having dinner out on the mountaintop. But there's lots of different ways to downshift. You can pray, you can meditate, you can take a nap, you can have happy hour like they do in Sardinia. But finding a way to do downshifting is important as part of the blue zones. Another principle, number 4, the 80% rule. And in Japanese, that's hara hachibu, which means when I begin to eat, I will eat until I'm 80% full and then stop. And so Americans don't dig that. They're too used to all-you-can-eat buffets and wholesale club, buy them high and pile them high and buy them cheap, and we have to realize that we don't have to eat everything on our plate. When we grew up, your mother said, "Clean your plate." Maybe we should rethink that, right? We should rather eat until we're 80% full and then stop. And also with the 80% rule is that most of the blue zones peoples eat their smallest meal of the day in the evening, and then they don't snack after that, as a general rule. Number 5, a plant slant diet. Now, notice not a vegan diet, that there's really no cultures of vegans when we look at all of the blue zones. The Seventh-day Adventists in Loma Linda, California probably get the closest because they advocate a vegan diet. But when you look at the health records of the Seventh-day Adventists, some of them are vegan, some of them eat a little meat, some eat a lot of meat. And in fact, there's been a lot of scientific studies following the Loma Lindans. And when you look at rates of things like colon cancer, it correlates perfectly to the amount of animal fat and animal protein that they consume. So Most of the Blue Zones people eat some meat, but they don't eat it like Americans. Another author that I follow is Michael Pollan, who wrote The Omnivore's Dilemma, and the opening line of his book is very simple, and it's very profound, and it fits into several of the Power Nine. He says, eat food, and by that he means eat real food. If your great-grandmother wouldn't recognize it as food, don't eat it. Second line, mostly plants. And by that he means mostly plants. And like the 80% rule, not too much. So I read that 10 years ago and I said, oh, let's forget about that mostly plant thing. I think we can work around that. Can't we do like grass-fed, whatever? But my years of study with diets, mostly plants, is the way it is. Our dear President Bill Clinton had coronary bypass surgery, and he continued to eat his fried chicken and macaroni and cheese. And his coronary bypass grafts were blocked off, and he had them stented open, and they said, last chance, buddy. And so he changed to Dr. Caldwell Essenson's diet, which is a very plant-based diet. And actually, that's been demonstrated that you can reverse heart disease with a strict plant-based diet. So when you talk about, I don't want breast cancer, and I don't want colon cancer, and I don't want prostate cancer, and I don't want cardiovascular disease, look at the plant-based diet, mostly plants. Our dear President Thomas Jefferson was a plant slant diet guy. He said meat he uses as a condiment for the vegetables, which constitute my principal diet. And Thomas Jefferson lived to be 83, which for his day was pretty good. You know, the average lifespan for someone in 1800, 35. So yeah, he was above average. And then we look at the carry of grease. When you look at the pie chart there, you can see that the first 5 things on there are plants. They do eat meat. They do eat fish. They eat very little sweets. It's mostly healthy plants. Principle number 6, wine at 5. Not everybody in the Blue Zones drink, but most of them do. The Seventh-day Adventists advocate against alcohol, but some of them drink. And the Okinawans don't drink very much, but the Sardinians and the Greeks, they like to drink. But basically, we've got evidence from all over the place that 1 or 2 glasses of wine a day, and possibly different alcoholic beverages, but certainly the data is there for wine, and somehow red wine seems to be a tad better than white. But it's a principle of the Blue Zones that 1 or 2 glasses a day does extend longevity. And in the Blue Zones, they usually do it with friends and or with food. So it's not drinking to be drinking, but it's drinking to be socializing, and drinking celebrating food. Principle number 7, belong. Dan Buettner has interviewed 263 centenarians, and 257 of them belong to a faith-based community. It doesn't seem to matter what the faith-based community is. Certainly the Japanese are Buddhist, and the Loma Lindens are Seventh-day Adventist, and the Sardinians are Catholic, and the Greeks are Greek Orthodox. So there's all different kinds of religions, but religion in your life, or a faith-based or spirituality in your life, extends your life. It looks like 4 to 14 years. So belong to something. Principle number 8, loved ones first. People in the Blue Zones, they cherish their elders, and they keep their parents and grandparents nearby, a lot of times in the home, sometimes near the home, but they cherish their elders and they keep them nearby. Most people in the Blue Zones commit to a life partner. That certainly extends longevity, to have a life partner. And they also make it a priority to invest time in their children and love their children. And in turn, their children then, if they have been had lots of love, turn that back to the parents and take care of the parents as the parents get older. Principle number 9, choose the right tribe. Most of the Blue Zones people are born into their tribe. If you're born in Okinawa, you grow up in Okinawa and you learn from the elders. The Seventh-day Adventists in California, some of them migrate to California because they choose that lifestyle. But nonetheless, whether it's chosen by birth or chosen by self, you choose people who have like-mindedness. The Okinawans create moais, which are friend groups. And this on the screen is a picture of some Okinawan ladies. Everybody in the room is 95 to 100. And they've been together since they were 5. So make friends and keep friends and cherish your friends. And pick good friends, because we know that social studies have shown us that smoking and obesity and happiness and loneliness are all contagious. You hang around happy people, you'll be happier. You hang around fat people, you'll be fatter. So a lot of people then said, oh, by the way, that was the 9 principles of the Power 9. All right? It's pretty simple. Do you have a better solution? If you do, you can talk to me afterwards. But these are pretty good program for living a long life. But we don't want to live just a long life. We want to live a happy life. And so Dan Buettner's latest work is The Blue Zones of Happiness, a book that just came out this year. And they looked at all over the world at where the happiest places are. And I put the legend up first because you can see GDP, it helps to have some financial success, social support, healthy life expectancy, the freedom to move around and make life choices, generosity in a community, the perception of corruption or absence of corruption, and the dystopia. I had to look that up. Dystopia is the opposite of utopia. So if you are in Syria and don't have any electricity and don't have any food and you're getting nerve gas, you probably have some dystopia. So where are they? The Scandinavian countries typically come in, they do these surveys through Gallup annually, and the Scandinavian countries typically have a lot of social awareness, and you know, people say, yes, but they're socialists, for heaven's sake. And they do have free education, and they do have free health care, but I must say, having been to Scandinavia, you notice that Scandinavians aren't as grabby as Americans. Standing on the street corner of Stockholm, there was a crowd on both sides of the street, and I saw that it was a little side street, there's no car coming. I thought, why can't we cross? And there were 200 people on both sides of the street. They waited for the walk light, because everyone stays in the system in Scandinavia. They work with the system, so they obey the rules, and that makes it work better for them. You might notice that the United States is down there, number 18. That's not too bad on the list, but could we do better? And I'd say, yeah, we should look at that. When we look at the bottom of the list, we see bad places in the world like Yemen and Rwanda and Syria and Liberia and Afghanistan, and you can see that the corruption and the dystopia are heavy in the dose of why they're at the bottom of the list. But then if we look at the United States, the happiest places seem to be Colorado, California, and Charlottesville, Virginia. Places where there's a good social system, where people are engaged in their community, where they have a nice place to work and play, and I suppose they're around like-minded people. But we didn't make the top 25. And for the sake of brevity, I'm just going to tell you that Dan Buettner has a Power 9 of happiness, which overlaps with the Power 9 of longevity in many ways. But just very briefly, this Power 9, love someone. That if you have a life partner, that you'll be happier. Have an inner circle, cherish your friends. Find 3 friends that mean a lot to you and cherish them and take good care of them. Engage in the community, get active, do things. Learn likability. That's an interesting one. Basically, introverts, you have to practice being likable. And so you have to get out there and find friends and practice being extroverted even if you're not extroverted. Move naturally, right off the other Power 9. Look forward. That, you know, people who are happy have something to look forward to, and they plan, and they make plans and execute them. Sleep 7 hours or more. So you have to work at sleeping 7 hours or more. You just can't do it. You have to think about cutting off the caffeine, and you have to think about exercise during the day, and watching out for naps and all that sort of stuff. And shape your surroundings. Some of this is in your hands, that you can shape your work and shape your home and shape your finances and create happy spots. And again, pick the right community. That you need to pick like-minded people. So let's now take the big idea and ask the question that Dan Buettner found all these long-lived and happy places, but could we replicate that in American cities like Savannah? And should we measure that? And the answer is yes, if we're going to prove that what we're doing is a good thing. So in a bold move, they started the Blue Zone cities in America. And the first one was in Albert Lea, Minnesota, which happened to be a small little town that was fairly homogeneous and was fairly small to tackle, about 17,000 people. And then next were the beach cities in California, Manhattan Beach, Redondo Beach, Hermosa Beach. And those three are in contact together. They band together. It's a place of about 130,000 people. And then the state of Iowa got bold and said, let's make Iowa a Blue Zone state. And there are 10 Blue Zone projects in the state of Iowa. And since then, the state of Oregon joined in, and cities in Hawaii, and Naples, Florida is the closest one to us. And recently, Fort Worth, Texas has been cranking up, and that's the largest Blue Zone project to date. So the concept is engage the communities, change where people live, work, and play, and make the healthy choices easier. Nudge people toward the healthier choices. And when you do that, you look at individuals' life radius, that everything you do, or most of what you do, happens in the 20 miles around you. So you want to make that 20 miles around you livable and workable, and make it easier for the healthy choice. So in the Blue Zone cities, they get people, they advertise and explain what they're doing and get people to take an individual pledge, and they like to get 15% of the community to take the pledge. That takes lots of volunteering. If we look at our Savannah Blue Zone project, we're going to need 15 full-time employed people and about 125 volunteers. So your names are all on the list, okay? Social networks, they make a deal about, let's create a moai. Let's, have your own moai, your friendship group, where you get together with your group and have walking moais and take walks with your group and look after your friends. They get grocery stores and restaurants to put up Blue Zone friendly choices. And they get the restaurants to put Blue Zone friendly entrees on the menus and certify them as Blue Zone friendly restaurants. They get the schools and the employers and the churches involved to have programs. And then they create a built environment where they try to make things more walkable and make exercise the easy choice. And Healthy Savannah has been, as you just heard, has been working on the Truman Walkway, and then there's bike paths downtown and completed streets. And so a lot of that work has been going on in Savannah, but you kind of pick that as pick a marquee project to try to make the built environment better. And then there's food and tobacco suggestions as well to try to get people to quit smoking. So in these Blue Zone cities, they pick a couple of short-term projects and long-term projects, and this is all, they basically bring the community stakeholders together and they pick out priority things. So every city looks a little bit different. And so there are some ideas like walking school buses, where instead of taking a school bus, that they get volunteers, sometimes retired people, to walk with the kids and create a safe walk to school rather than taking the bus. In the grocery stores, they have checkout aisles and little aisle talkers that point people to healthy choices, and rather having unhealthy choices in the checkout aisles, they have Blue Zone checkout lanes, and they have Blue Zone parking spaces, which are far out where you You park out and walk into the grocery store. So let's just look at a few cities here to see what's happened out there. In Iowa, like I said, there's 10 cities, and these are just some little, I call them brag sheets, where they have little achievements. In Muscatine, Iowa, they had a $5.3 million completed street project. They created a lot of public gardens. It's a good way to get exercise and feed yourself. So more community gardens that are coordinated. They got most of the grocery stores to agree to be Blue Zone's grocery stores. And then on their riverfront, their marquee project was that they had a lousy riverfront, and they changed the and redid it, spent $100 million. They got a grant and working on a $100 million renovation to make the area more livable. Albert Lea, Minnesota, the very first Blue Zones project, that started in 2009, and it takes funding, and it had a lot of funding partners. The Mayo Clinic Health System was a big one. But they had community garden plots. They stopped selling pizza to raise money and got people walking to raise money. They put healthy options in the city vending stands and did all the measuring. And their marquee project was a community boathouse, to where people could then have easy access to kayaks and canoes and paddleboards and snowshoes. And they did a 18-hole frisbee course that was donated to the city. They had walking school buses, walking moais or walking friend groups, Blue Zone checkout lanes, a lot of neighborhood picnics and social events, restaurant certifications, worksite wellness, where they worked with employers to make the worksite a healthier place, and they worked on a completed street policy to get, and certainly Paula and the Healthiest have been working on that. Tobacco-free campuses, worked on improving the downtown streetscape, new sidewalks and bike lanes, and had a lot of people that were on the team to have the leadership. And then some results. After 6 years in Albert Lea, they had their metrics showed that they were adding 2.3 years of longevity to the residents' lives. The city arena started selling healthy choices at their arena, and their sales actually went up. Their health premiums had no change to single digits for several consecutive years. I don't know if that's still true or not. And their workers' compensation claims and absenteeism was down as a result of people being happier about their jobs. We talked about the community boathouse, a lot of new community events, and this results in more investment in the city. That there's $4 million of private investment in a little town of Albert Lea, Minnesota, and sales tax and lodging went up. So people are thriving in Albert Lea. And they saw that when you compared the rest of Minnesota, that they were jumping up in the health rankings, that they were having positive numbers in overall and tobacco use and obesity. They actually didn't improve. They got a little fatter. But the quality of life and the length of life and health behaviors, all metrics, all went up and improved compared to the rest of Minnesota. And then with the Gallup Healthways Wellbeing Index, which will show you Savannah in just a minute, their pride in the community went up, smoking rates went down, eating produce went up, obesity went up, but 85% of the residents of the Blue Zones project. That's good. You have a few numbers that are off. That means it's probably real data, right? And when you looked at the people who, their exercise went down, that was in 2 years, so that might be a bad one. But basically, a lot of positive numbers. That people eating 5 servings of vegetables a day went up, and smoking went down, and then also the use of mind-altering medications went down. And with the tobacco rate drop, they estimated that they might save $8.5 million in healthcare savings to the Albert Lea employees. So you take a little flyover city in Minnesota, and they climbed out of an economic crisis, and they made the place a better place to live. Let's look at the beach cities of Redondo, Hermosa, and Manhattan Beach in California. Here was their marquee project. They did a bike path that connected the cities and made it easier to get around the cities. And here they had 23,000 people took the pledge, which that's about 1/5 of the population. They got 5 grocery stores to sign on and 40 restaurants to sign on as Blue Zone. And they got 28% reduction in smoking over the course of 5 years. They had the walking school buses and lots of Moai participants. And so let's look at the numbers. Did they get their money back? That's a question investors would like to know. Will we ever get the money back? And so here's a little value proposition, and in fact, they did. What they found was that if you get people being more healthy, having healthier behaviors, then it lowers their medical costs and it decreases their work absences and work impairment. So workers' comp claims go down and absence from work goes down. And ultimately, that is economic value back to the community. So what's the cost of doing nothing? Well, believe it or not, the cost of medical care is going up faster than standard inflation. So if we sit here and do nothing, it's going to get more expensive. So it's time to do something. And the same with productivity costs. That productivity cost, time off from work, and workers' comp claims, those are rising faster than inflation. So intervention is better than doing nothing. So in the beach cities, they did all of these metrics, and they measured and 7 things that went down over the course of 5 years were, they measured stress as a metric, tobacco use, exercise, nutrition, the BMI, your body mass index, the blood pressure, and the total cholesterol. They had improvement in all 7 of those metrics. And that translates to an improvement in health. When you look at the metric of people who felt like they're thriving, that went up. People who were obese went down. And the number of smokers actually went down, but it just went down at the national average. And the people who exercised and ate fruits and vegetables 4+ days per week went up. And so they were able to translate those into actual medical savings. So when you look at the medical value of all of those things, you know, lower cholesterol, lower blood pressure, that translates into fewer events. And when we look at the 5-year value of the medical savings, it was $21 million, and the productivity savings, $21 million, a total value of $42 million. So in the beach cities, they returned $42 million back to the community and project that over 10 years, it could be $125 million. So where are we now, Savannah? We have some barriers to success. And when we look at our community, poverty, racial divide, interferes with progress. Deep South cuisine, you cannot stay healthy eating pulled pork barbecue and fried chicken for the rest of your life. And then there's tradition in Savannah, and that's a good thing, but sometimes that translates to a great resistance to change. So when you look at the well-being of U.S. cities, there's 180 of them, and 190 of them, and Savannah's 161st. We could go up, couldn't we? We got nowhere to go but up. And when you look at Georgia, it comes in, it's over there 41st. So we could go up, where there's room for improvement. So my big idea was, could we make Savannah a Blue Zone city? And let's think even bigger, could we make Georgia a Blue Zone state? So in 2015, Tony Buechner happened into town and gave a presentation to 41 stakeholders, and nothing happened. And I got interested in this in 2016, and we adopted as an initiative, and I presented to the Georgia Medical Society, and then Tony came back in 2016 and presented to the Georgia Medical Society, and nothing happened. People said, well, who's going to pay for this? So we looked at the budget of doing this, and it cost probably about $5 million. But now that we look at the beach cities and we say, let's see here, $42 million in return for a city of 130,000. Could we get a return of more than $42 million back for an investment of $5 million? And the answer is yes. Is that expensive? Yes. But if you compare that to the cost of doing nothing, it only gets worse. Do we think that we should be comfortable in where we are right now, that we've got it all figured out? Well, if you go to Kroger, I'll make fun of Kroger here, they have a wellness section, and all of it's pill bottles. And I don't think wellness is in a pill bottle. But, and when does anybody see any pictures of their great-grandparents? Here's mine, Carl Meinrad Exley. He's the good-looking gentleman there in the vest. Okay? And for all you Savannians who, there's Exley family here in Savannah, E-X-L-E-Y, I got two bad news, two things of bad news. Number one, Exley is spelled O-E-C-H-S-L-I. That's the German spelling. And the other bad news is that I might be your cousin. But look at that man. He's thin, he's fit, and his brother, the potato farmer, is on the left. And you might say, well, who's the fat guy on the end? He owned the pub, the first beer garden. So as we fast forward to today, I was in Brooklyn and I had my beautiful family with me, and some amorphous blob stepped in and photobombed the picture. I couldn't believe it. So we're all at risk for obesity. And if you think we're winning the war on obesity, I would say we're losing. Do I have 3 minutes?
Yes.
Well, let me just, I'll make it short. And when you look from 1990 to 2010, we have been getting fatter, and I'll run the video if I have time. And we have opioid deaths are coming at a rapid rate, but we do not have this figured out. We need some form of intervention. We need some form of preventive medicine. So I would say, Savannians, we're losing the war on health, and we need a proven pathway toward long health, long life, and happiness. And I would propose that employers, corporations, health plans, hospital systems might be interested if we give them a good return on the investment. I think I showed you today that we could. And the Blue Zones gives us an evidence-based approach for us to make a healthier, happier, longer lives and make Savannah a more livable city. So, the last time I gave this talk, I said, like us on Facebook, and I had got, 200 likes. But I'll say, we've got to fight this war, and I want you to join the Coalition of the Willing. So please, like me on my Facebook page at Blue Zone Savannah, and when you communicate on that, please volunteer that I would like to be part of the Blue Zones, and these are my talents. And let's identify the community stakeholders and have them, let's all step forward. And please contact me at Blue Zone Savannah or at my email address, lukecurtsinger@gmail.com. So, if I have 3 minutes, I just want to make you sick and show you what has happened to obesity in the last, go away, go away, go away. It's new in PowerPoint tonight. Here it is. So, here is the CDC puts out what's going on with obesity, the people with a BMI over 30, and it's a continuous thing here. 1989, 1990. Watch, as it gets darker, we're getting fatter. 1992, 93, you see West Virginia and Mississippi will lead the way. 1995, 1996, Colorado will be the last one. 1997, 1998, 99, it's going to get worse. It's going to get redder. 2000, there's Mississippi. There's West Virginia. 2003, 2004, it's getting worse. 2006, 2007, 2009. So we just can't do nothing. We just can't sit here and do nothing. We have to do something. So I suggest that you join the war on obesity and on bad health, and we will make Savannah Blue Zone safe. Thank you.